Many people have not heard of interstitial cystitis. It seems to be a very poorly understood condition. Can you explain what interstitial cystitis is?
Interstitial cystitis, or what people refer to often as IC, generally causes overall bladder and pelvic pain or discomfort, and it's often associated with urinary frequency and urgency. And these symptoms are typically aggravated with stress and also with certain food and drink, especially ones that are acidic. So the actual cause of interstitial cystitis is not known, but it affects women typically between the ages of 20 and 50. And it affects many more women than men, so there's probably some type of hormonal influence as well.
What are some of the more common symptoms of interstitial cystitis that someone should look out for?
So if someone's going to the doctor and they have typical urinary tract infection or UTI symptoms like bladder pain or discomfort, burning with urination, urgency, and either their urine tests don't show infection or they don't get better with antibiotics, then another cause should be sought. The problem is, in my practice at least, what I see is every time a woman has any symptoms down there, she's immediately diagnosed with a UTI. So by the time I see her, she's been treated with multiple courses of antibiotics, which not only aren't helping her situation, but often cause other things like GI upset or other things like yeast infections.
Yeah, I mean, that's exactly what happened to me. I kept continuously going to different doctors because I had what I felt like was a UTI because I had one. They just kept putting me on different doses of antibiotics. At what point should someone see a doctor, and what kind of doctor should they see first?
I think a better question is, at what point should they see a specialist? Unfortunately, most people I see have already seen a lot of doctors, and just like your experience, have been treated for recurrent bladder infections or other conditions. So I think that if you've had several appointments with your primary doctor and you're not getting any better, I think that's probably time to consider seeing a specialist, either like a bladder specialist, a urologist, or someone who specializes in the pelvic floor and pelvic pain, like a urogynecologist.
How would a real doctor diagnose interstitial cystitis?
As opposed to Dr. Google, checking the urine to make sure there's no infection or blood or other abnormality, sometimes looking inside the bladder with a camera called cystoscopy, but there's no specific test that will tell you whether you do or don't have interstitial cystitis. So the tests that are done are to just make sure that you don't have something else.
That's what's really frustrating to me is I know when I first started getting symptoms, not knowing exactly what was wrong with me because there was no proper way to actually diagnose it.
It is. It's frustrating, I think, for both the patient and the doctor. Although there are some things in the history that make you question if someone has interstitial cystitis, because almost everybody notices that their symptoms flare with stress, that they have food triggers, or if someone says, yeah, my symptoms are connected to my cycle same time every month, those make me think that they don't have interstitial cystitis.